My name is Mrinal Supriye and I'm one of the ENT head and neck surgeons. I'm the clinical director for the Joint Up ENT and head and neck service across both Northampton and Kettering. And I'm delighted to be able to share with you the vision and the priorities we have for this collaborated service. The vision for our service is to provide the best quality, world-class head and neck service, which includes ENT, maxillofacial, and audiology for the population of this county. And in doing so, we want to make sure our service is effective, efficient, and up to the standards for the best that's out there. So in the past, if you came in contact with the ENT or the maxillofacial service, either at NGH or KGH, you might have noticed that both services were completely separate. And because of that, we struggle to provide the patients of our county a senior clinician delivered service 7 days a week. And that led to problem and the service was inefficient. So what we have done now is we have joined up our service and we have prioritized by looking at the delivery of emergency service to begin with before we go on to the elective services, which means your routine surgeries or routine appointment to the clinic. And this is going to lead to a more equitable service for the patients of our county, and they will be able to access the latest up-to-date service, whether it be for surgery or for a review in the clinic. So how does it matter for you? So now, for example, if you require an emergency care, you will have a dedicated on-call team, which is led by a week on-call consultant and a week on-call registrar. So what you will notice is that you have got, first of all, a senior presence to look after you 7 days a week, and you have continuity of care because you will have the same team of doctors looking after you if you require hospital admission, for example. This will inevitably lead to better care for you and a quicker resolution of your clinical problems. You will also find that we are able to provide services closer to home. For example, if you do not require hospital admission, there will be a regular everyday emergency clinic both at NGH and KGH, which means that for common stuff, for example, ear infection or something stuck in the nose of your kid, you can access that service closer to home. However, if you are more unwell and you require admission in the hospital, you will not need to go through ED twice at both NGH and KGH because you will be directly admitted to the head and neck ward after you have been seen by the on-call ENT doctor. This will mean your clinical care will be more quick, and because you will have been under the care of a consultant, it will also be better quality. If you require emergency service or emergency surgery, the on-call consultant will have freed up time to take you to theater. So obviously your surgery will also be quicker. Overall, what this will mean is you will get the appropriate treatment at a quicker timeline, and you'll be back to your home and your family much quicker than what we could offer you in the past. How will it impact if you don't require emergency care? Because of a joint up clinical team and because we have also got a uniform clinical policy across the county, you will get more dedicated subspecialist care. For example, if you require a day case surgery, it will be delivered both at NGH and KGH. So it will be closer to your home. But if you require more complex cases such as a cancer treatment for whether it be ear, nose, throat or a throat cancer, it will be provided at a dedicated ward at NGH. And because we are pooling our resources, you will be able to access high definition treatments such as a robotic treatment that is starting in NGH hospital. It will also mean that we will be able to offer you increased chance of recruitment to national or international clinical trials. Because of all of this and increased availability of teaching and training opportunities, it will also improve recruitment and retention. And that is extremely important for a smaller service like ours, where there is a national shortage of eligible appointees. So hopefully, with this service model, as we move ahead, we will be able to provide you even more refined and even more sub-specialist care. In most cases, closer to your home, but if you require more complex service, in a dedicated head and neck ward provided by a dedicated sub-specialist team.